Welcome back. Once again, it's Health and Wellness Thursday. Now is the time to think about Medicare enrollment. What do you need to know about this current period coming up and much more? We recently spoke with a Medicare expert about everything. Let's take a look.
The Medicare annual enrollment period is almost here, and with more than 10,000 Americans turn 65 each day, the need for clear information on Medicare is more important than ever. Joining us now to discuss is Rick Dunlop, Health Plan CEO at United Healthcare, Medicare and Retirement. Rick, thanks for joining us today.
Hey, good morning. It's great to be with you.
When is Medicare annual enrollment, and tell us more about the importance of this time?
Well, timing is everything. And so if you see that 65th birthday around the corner, you can enroll in Medicare 3 months before you turn 65. The month you turn 65 or the 3 months after that. Now, if you're already enrolled, the great news is you get to, just kind of let that roll from year to year. You don't have to re-enroll. And then the even better news is you've got annual enrollment that's starting October 15th and extending through December the 7th. And providing everybody an opportunity to kind of update their benefits to match their, health and financial circumstances.
What are the most important things to consider when enrolling in a Medicare plan?
I usually, suggest that people start with viewing it as an opportunity, again, because every year it gets just a little better and there's like different options that are available and you just don't want to get to the other side and feel like you missed out on something. So you start out by making a list of all the physicians and the hospitals and pharmacies, those care outlets that you want to make sure you have access to, as well as the medications you're currently taking and if possible, something you foresee you might need to take in the coming year. And then sit back and think about, is my current plan really working for me? And most of the time, you can probably say, yeah, but there might be something better out there because of the financial circumstances. And so you want to make sure you're protecting the pocketbook, so take a look at copays and premiums, look at it holistically just to make sure it's working for you, and then start checking the market to see what's available.
How can we make sure we get coverage for the medications that may be needed?
And you know what? That is an incredibly hot topic. And so what I can share with you is it's been my experience that if you're signing up for a Part D plan or a Medicare Advantage plan, one of the things that's available, regardless of who you might be signing up for that through, is tools that would identify sort of what's included, how it's included, what the financial costs could be, whether on it's a monthly or an annual basis, mail order, or picking it up at a retail outlet. And what you should do is sit down with your physician and make sure that the medications that you're taking, are the best options for you, because sometimes there can be a generic that can be better or a brand equivalent to a brand. So you want to make sure you're looking at those, but there's a lot of tools in the enrollment process to make sure that you have access to the right things.
Can you discuss the different types of Medicare and how they differ? And what is the difference between original Medicare and Medicare Advantage?
I love that question. It's kind of an alphabet soup. So original Medicare is made up of Medicare Parts A and B. And Part A is going to be your inpatient care. It's going to be hospitalizations and skilled nursing facility. Part B is going to be the professional services, your physicians, your specialists, as well as home health and maybe a few other things. But original Medicare only covers about 80% of total expenses. So what we find is that people will pick up a Medicare supplement to help them offset those expenses, as well as a Part D plan, D for drugs or medications. So there's some added upfront costs, but what we're seeing in increasing numbers is people adopting Medicare Advantage because it includes, it's also called Part C, but it includes Parts A, B, D, plus it'll include things like dental, vision, hearing, sometimes transportation. And one of the things that seems to be incredibly popular these days is that gym membership, a gym membership at no cost to the consumer. So it's a real way to, in a holistic way, think about somebody's health and wellness, because a lot of times it's much more affordable.
And where can we find more information?
This time of year, you're going to find a lot of community meetings popping up that are fully education related, or you can go to gettoknowmedicare.com for written content as well as webinars you can watch from the comfort of your own home.
Well, thank you so much, Rick, for joining us today. I appreciate this important information about Medicare, the annual enrollment, plans to consider all these things. Thanks for sorting it out for us.
Thank you very much. Appreciate the time.